Hello everyone on another episode of Conscious Doctors. And please join me in welcoming Dr. Shubham Jain today, who heads the Oncosurgery Department at Manipal Hospital, Dwarka in New Delhi. Thank you, Dr. Shubham, for being with us today.
Hi Charu, how are you? Thank you for
I'm
having me
good.
here today.
It's our pleasure entirely. Dr. Shubham, thanks for giving us your time. And in order to not take too much of it, we will directly dive into, the conversation about holistic approach of cancers today. Right. So maybe we can begin with by addressing the point as to what are the most common cancers that you are seeing in your practice today.
So Charu, the most common cancers that affect Indians are in men. Most commonly, we see the breast cancer, the cervical cancers as the most common ones. Whereas in men, because of the habit of tobacco consumption and pan masala, probably head neck cancers are the most common ones. But globally, we see, and India too is witnessing it as lung cancers being the most common ones in men.
Okay.
Apart
Okay.
from that, the GI cancers, both upper GI, that's the stomach and the esophagus, and the lower GI colorectal are also pretty common in Indians.
I see. So, I have also I have started hearing a lot about cancers even in my family and friend circle, which was not so much the case before. So, what do you think is? You think really the prevalence is rising, and if yes, what is contributing to it?
Absolutely, Charu. I think there are multiple reasons that we are hearing more and more about these cancer cases now. One obviously is a better access to healthcare. Now, what
Hmm.
it has done is one, it has knocked off other causes of death as the most prevalent causes. Like there used to be a time where most people used to die of infectious diseases or cardiac diseases. Because people are getting better healthcare facilities now, these causes of death have actually become lesser mortal, and that is why more and more complex diseases like cancer are becoming more and more prevalent. Another reason to it is the better access to diagnostic facilities and more awareness amongst the general population
Hmm.
regarding cancer. So somebody who wouldn't have been diagnosed with cancer previously or would have just been labeled as died due to old age is now getting diagnosed as cancer in an
Hmm.
effort to get treatment. And whether we are able to salvage him or not, the cause of death then gets labeled as cancer. Having said that, definitely the westernization of our lifestyles,
Hmm.
that has been a major contributor to the rise in the incidence of cancers. The more prevalence of smoking and other tobacco products, the more alcohol that we are having in a diet, that is definitely a reason for the rise that we are seeing. And not just that, I would say that even if somebody is a teetotaler, not uh,
Hmm.
consuming alcohol or smoking, even that segment of population is not entirely spared of cancer. There are other factors
Hmm.
that we
Hmm.
don't understand, including genetics, for
Hmm.
example, that predispose an individual to developing cancer. So really what I feel is that ignorance or not knowing about cancers is no longer an option. One needs to be aware about the problem, how to better diagnose it, and the best precaution or prevention somebody has is the awareness of the disease so that they're able to identify and pick up these symptoms in time. And obviously the sooner we detect this problem, the easier it is to treat and the better are the outcomes.
Right. No, thank you, Dr. Shubham. I think that was quite a comprehensive collection of the reason that we are seeing more cancers today, and you touched upon lifestyle as well. In lifestyle, do you think that stress and the food that we are eating has also been contributing to it? Like I see so much of processed and junk food around, and in people who are teetotalers, as you said, they are also suffering from cancers. So could it be that they are not having access to natural food? And I think even for us who are not eating outside, the ingredients that we are using at home to even cook our home meals seems to be all adulterated. And do you think that also could be leading to this?
Absolutely, Charu. There is no reason that we can totally ignore them as factors that are
Hmm.
contributing. There are
Hmm.
studies that are actually at best showing controversial results or
Hmm.
inconclusive results. They're not able to confidently say that these are not contributing. to cancers, but yes, we do generally accept them as markers of an unhealthy lifestyle. And probably that could be a reason that we are seeing more and more cancers among the Western population. For example, the age incidence of cancers has dramatically decreased in the last few years. Previously, it used to be
Right,
considered, when we were studying, it used to be considered as a disease generally associated with the elderlies. But
right.
now all of us are seeing more and more younger people also getting affected by it. So definitely the lifestyle that we lead today, the amount of stress that we go through, the technology that is around, all this would definitely have some role to play in the development of cancers in us.
Understood, understood. All right, let's come to the advances in healthcare and medical technology, which is now allowing us to treat more and more of these cancers. So, what are the different treatment modalities available? If you could share that with our listeners, that would be very helpful.
So the technology and medical science has improved by leaps and bounds. It is actually broadened the scope of treatment for cancers. At one hand, we are now able to detect cancer earlier with the help of screening technologies, as a result of which we can do minimally invasive surgeries, which help in faster recovery of the patient to put them back on track on their lives as soon as possible. Also, hand in hand, we can now de-escalate the therapy, which basically means that somebody who would have been requiring the combination of surgery with chemotherapy and radiotherapy, with our better understanding, we are now able to just administer one therapy to the patient and keep the other in our armamentarium as a reserve for an unfortunate event like a recurrence. Now, that is one end of the spectrum where we are catching the disease early. The other end of the spectrum is in advanced cases. So cases which were metastatic and deemed to be inoperable or unresectable or something for just palliative care previously, the scope and the horizon of treatment is now increasing to treating even these metastatic patients. So for example, surgically, we do metastatectomies in the lung and the liver for these patients. There are surgical modalities by the name of HIPEC and PIPEC, which help us in treating patients with advanced peritoneal or pleural diseases as well. And the kind of results that we are seeing, it's actually very encouraging to see people who we would have initially thought would not survive for more than 6 months, living around for 3 to 4 years. Not just in the field of surgery, even in the field of medical oncology, for example, the role of targeted therapy and immunotherapy, which are basically drugs which can be taken orally. So they are very convenient for the patients to take. They are drugs which have lesser side effects, so they're easier to tolerate. Unfortunately, they are quite expensive right now because of the research that goes into it. But
Mm.
hopefully in the time to come, there will be more and more generics of these medicines that would come up. And as a result, it will be more affordable. Uh, Speaking of radiation oncology, precision is probably the keyword there. With the proton therapy and many other advances, they are now trying to reduce the side effects that are caused by the radiation. So overall, Charu, what I would like to say is that the focus now is not just adding years to the life of a person, but also life to the ears for a patient that we are treating. So definitely quality of life, the cosmetic concerns of the patient, fertility issues, all these are gradually coming to the forefront. And the oncology world is now definitely realizing that just treating cancer is not enough to put a person back on track. We need to have a holistic approach to give the life back to the patient actually.
I think that is just very, very pleasant to hear, Dr. Shubham, about the life to the years and the holistic approach, the quality that you mentioned, because you touched a little bit on the side effects of especially chemo and radiotherapy, which I think are the key factors in, the life deterioration of the quality of life of these patients, unfortunately. So, could you throw a little bit of light on what these side effects are? And I know that with immunotherapy, they are coming down, but as you rightly said, not everybody is able to afford immunotherapy today. So, a lot of patients would still go through chemo, radio, the traditional treatment modalities. So, what kind of side effects do these patients have to face in your experience?
So, Charu, first of all, the thing is the fear of the word cancer itself and its treatment is a big deterrent to patients to just
Mm.
opt for the correct treatment. Many a times they would confuse their medical condition with near and dear who would have suffered cancer, and they put everything
Mm.
in the same basket.
Mm.
So, having this knowledge or information and awareness that all diseases are different and the advances in medicine is the first thing that needs to be understood by the patients. Secondly, the kind of side effects that the patients generally come across would include fatigue. For the chemotherapy, it would be more of nausea, vomiting. Obviously, the psychological depression that a patient who's being diagnosed or treated with cancer,
Mm.
that does put the morale down. And all of this just needs a good counseling by the treating doctor, and good support by the family and the society to just uplift them and just go through tide over this tough time of their life. Usually this hand holding, in my experience, for the patients does give good results, does give them confidence, and it's a matter of a 6 month to 8 months treatment usually for most of the patients. And once they are through this, they definitely look back and they're very thankful. Usually, the way I've seen, they're very open to participate in support groups as well. And once patients see other patients who've crossed this journey, it's very comforting to them that such therapies do work.
Amazing. That is really nice to know. Uh, Apart from the counseling and family support or social group support that you mentioned, Dr. Shubham, is there anything else which is coming up these days to help patients deal with these side effects?
Absolutely, Charu. There are many alternative forms of medicine that are now coming to the forefront. The Ayurvedic treatments, the psychological support, yoga, all these are being seen as stress busters for the patient, or something that they, can help them cope up with the side effects of these treatment. And in general, many studies that have been done do point out and allude to the fact that people who have adopted these alternative forms of therapy during the treatment have probably coped up better with the side effects and responded better to the treatment compared to people who have not opted for these alternative forms of therapy.
It is actually great that you bring about that there have been studies which have proven that people who resort to yoga and other therapies are able to deal with the condition and the side effects better. Could you help the viewers understand a little bit more about how these things actually act? Let's say if somebody is doing yoga or breathing exercises while they are on chemo or radiotherapy, or let's say if they are dealing with too much of psychological distress or anxiety or negativity because of the condition, how is the yoga part helping them cope with it? Could you throw some light on that?
So, from what I understand, is the stimulation of the vagus and the parasympathetic nerve is probably one mechanism. Reduction in the cortisol levels is another mechanism that helps patients cope up by decreasing the level of inflammation in their body immediately post-operatively. There are various
Right.
other mechanisms which probably the scope of our conversation will not allow us to go into, but it's very interesting and fascinating the way yoga works in helping our patients deal with the side effects of treatment of cancer.
It's really great, Dr. Shubham, to hear all of this in such an evidence-based manner, because it is important. Although a lot of people are advising yoga these days, it is very important to differentiate, the ones which are scientific from the ones which are not, because it is also very easy for a patient to, especially when they are dealing with cancer, it is very easy for them to fall into traps of alternative therapies which are not proven, which are not based by evidence, and might just end up making things worse for them, right?
Oh,
So I think it's
absolutely. Everybody becomes a
yeah,
doctor around you when somebody gets
right,
diagnosed with cancer. So it is
exactly.
very necessary for anybody to get convinced, be certain about what they're going through. Obviously, having an evidence backing whatever one is resorting to helps build the confidence and the faith in the process for anybody.
Right. Very, very happy to hear this, Dr. Shubham. And I think I will just like to close with one last question because I feel very impressed with your approach, your holistic approach to cancer management. What advice would you give to your fellow oncosurgeons and oncologists when it comes to cancer management?
So, Charu, I feel that the patient needs to be at the center of things, and that is usually what is fortunately coming across at the forefront at many centers of excellence for oncology that are growing now. There are tumor boards, various minds come across and decide a plan of treatment for the patient. But having this holistic approach that I was talking about and keeping the quality of the life in the center, I feel that the patient should be aware of the decisions that the oncologist is taking on his or her behalf, and having the patient get the confidence in the treatment and handholding is just very important for the patient to actually go through this tiring process. Otherwise, we've seen patients just getting fed up of the side effects, which are far too many for the patient to cope up unless and until there is somebody helping them.
Got it, got it. I think that's a great takeaway for many of us today. It will not just help cancer patients, but everybody, because unfortunately, I think all of us now are aware of somebody or the other going through this. So understanding that what kind of care is best will help them also choose the right doctors, the right centers, and I think it's very, very valuable in today's time. So thank you so much. Unless there's something you want to add, I'm happy to close this.
Thank you, Charu, for such a nice conversation. I think it's very important today's time to raise the awareness for cancer. The more we talk about it, the more the chances are that the people will be aware about such a problem existing, and people would not feel lonely. If ever somebody is diagnosed with it, they'd probably come out more openly about it. It's not their fault that somebody's developed cancer, and probably they also need to understand that they're not the only ones suffering from it. There are many who
Yeah.
have, and there are many who have conquered this.
Hmm. That's a very good message to close our conversation with Dr. Shubham. Thank you so much. Thanks for giving us your valuable time and your very valuable inputs. So thank you and have a
Thank you,
good day.
Charu. Take care.
Okay.
Bye.